Good day, everyone. My name is Reginald Salter. I am a proud member of Alpha Phi Alpha Fraternity Incorporated. I'm also a licensed dentist in Washington, D.C. and Maryland. It is my great privilege today to speak to you about oral health, and I want to thank our General President and all of the brothers who work on the Wellness Committee, the General Surgeon Committee for Alpha Phi Alpha Fraternity Incorporated, for this great opportunity. What I want to speak to you today is about a disease or condition that really affects a large population of the community, but especially the African-American community. And it is a condition or a disease that is oftentimes very much preventable. And that is the condition known as periodontal disease. I just want to give you a brief overview of what periodontal disease is. First, let's take a look at what your dentist is looking for when you have your oral exam. We're looking to see that your gingiva is healthy, no bleeding. We're looking to see that your gingiva, or when I say gingiva, I do mean gums, that they fit snugly around your tooth. We're looking for a coral pink color, and we're looking for the firmness of the tissue or your gums. Now, looking for a coral pink color can often be deceiving because and particularly in races with a high content of melanin, specifically African-American race, that is not always the case. So some patients often, when they see the coloration or the pigmentation of their gingiva, they oftentimes think that something is wrong. That is absolutely very common when you have a high content of melanin. The periodontium, that is the tissue, that is the surrounding anatomical features or structures that will support your tooth. And not to get too technical with you, but this is what we're looking for. Generally, this aspect called the gingival margin and the gingival sulcus, that is the area of your gums or your gingiva. When your dentist places the silver instrument there, we are measuring the depth of that tissue. There's a certain measurement that we're looking for that will indicate that your periodontium is actually healthy. As we go through the presentation, I want you to keep in mind that your gums have ligaments that connect your gums or your tissue to your tooth. Okay, that will be very important as we progress through the presentation here. I always stress with my patient proper brushing technique. You want to make sure that you have a soft bristle toothbrush. And you want to make sure that the toothbrush is angled 45 degrees to your tooth. That is to prevent mechanical wear of your gingiva. Because if you wear away your gingiva or your gums from the trauma induced by a hard bristle toothbrush or brushing too hard, the tissue will react by receding or moving away from your gums. And if your roots become exposed, then you will become very sensitive to hot liquids, cold liquids, ice cream, coffee will not be tolerable for you, and sometimes cold air. Again, I will re-emphasize, keep in mind what we're talking about or what we're looking at when we're talking about the periodontium. We're talking about the way or the amount of attachment of your gums to your tooth structure. So in diagram, this is what a normal tooth would look like. You have healthy bone, a healthy level bone, which is what we call around the cervical region of your tooth or the neck of your tooth. Okay. And then you have the gingival attachment above that. If you start to develop a disease called periodontitis, and that's usually due to a buildup of bacteria on the tooth, again, your gums, like any other part of your body, is going to react, and it will react by moving away from your tooth. And it causes inflammation of your gums. So oftentimes patients say, I do not floss because my gums are bleeding, or I'm causing my gums to bleed. That is an early indication that the disease process is beginning. That is called gingivitis. So you actually do not want to decrease your flossing. You actually want to increase your flossing when you're having bleeding of the gingiva. Now, what I would stress is you need to pay attention to the technique that you are using to make sure that the bleeding is not induced from improper flossing. Okay? You want to wrap the floss around the tooth and you want to make sure that the floss is actually going below or beneath your gums or your gingival margin, because you want to remove all of the bacteria that you cannot see. A lot of patients stress that they have a difficult time getting the string around the tooth, especially in the back areas. Well, there are many devices that you can use. One that I always recommend is the floss pick. It's very easy to use. You hold the floss by the handle and simply go in between your tooth. And again, I stress it is very important that you are making sure that the string or the floss is getting beneath your gingiva so that you are removing all of the bacteria that will stick to your tooth. Here's some things that you need to know. I would stress that, when the bacteria builds up on your tooth, it forms a pellicle or a sticky film on your tooth that is called plaque. And plaque can be easily removed, hence the use of the toothbrush. So it's very important that we are brushing after each meal when we can, but certainly in the morning and in the evening. And it's very important that we start our children out on using this method of making sure that they are brushing after each meal. Each time you eat, there's a film that's left on your teeth. So it's imperative that we remove what we can, those soft deposits from the tooth, which we call plaque. Once that bacteria or the plaque stays on your tooth for a day or two or even longer, it begins to harden. And when it hardens, you will not be able to remove that at home. That is called tartar. And that is what we, as your oral health care providers, it is our job to remove that for you. So your 6-month follow-up are always important, always important. And tartar can sometimes be easily identifiable at home, because if you are a coffee drinker or drink dark sodas or anything with a heavy caffeine content, or if you are a smoker, that nicotine, that tartar from those items, caffeine will build up on the tartar that has built up on your tooth and will cause a staining, as you see here in the second diagram. Now, once that tartar is there and not removed and stays there for quite a bit of time, it becomes very tenacious, very tough to remove, and it sticks to your tooth. And that is where we have the formation of calculus. And again, you have to keep in mind that image I showed you of the periodontium. If your gums are receding or moving away from your tooth, if those ligaments become inflamed, you will get more bleeding, and the calculus will spread below your gums to the areas that you cannot see when you look in the mirror. So here we are. We have plaque buildup. Again, plaque is soft, and it can be removed with the toothbrush and with flossing. And as you can see from the diagram here, the buildup in between the tooth is very difficult for the bristles of the toothbrush to get there. This is why flossing becomes very much important. And then you see the buildup of the tartar when it becomes a bit harder, when the deposits become harder. Okay? And that is when you will get the tartar buildup. And the image down here is when the tartar has been removed following a 6-month clean. So again, I stress it's very important that you stay on that routine of your 6 months cleaning. This is what you cannot see. This is what a patient cannot see at home. And this is what your oral health care provider will come into play. We examine every aspect of the tooth. And oftentimes we cannot tell that there's a tartar buildup at home when we look into the mirror. So that, again, more reason why those 6 months visit become very important. This is what you also cannot see at home. Once that buildup starts to spread below your gingiva or your gums and starts to stick to your tooth, if you look at the diagram on your left here, look at the darkened area between the tooth. Okay, and if you look at the borders of the tooth, it's very crisp. Now compared to here where you see little wings or little pellicles on the tooth, that is calculus. And that is what you cannot see at home. This is why radiograph or x-rays become important during your visit. What you also cannot see at home, what is going on in your body when you have periodontal disease, is that buildup. Remember, it's bacteria. So it will start to cause not only the recession of your gums, but it will cause loss of the bone that support your teeth. Growing up in rural Georgia, I always thought that it was a part of aging. It was a natural part of aging for people to lose their teeth. Now that I've learned better, I know that a lot of the people that I knew in my neighborhood or my communities we're suffering from periodontal disease, because if you're losing the foundation around your teeth, the teeth become very loose, and essentially you will lose them, whether they fall out on their own or you eventually will have them removed by your oral health care provider. So again, using the image, a normal tooth, healthy bone, healthy gingiva that is attached to the tooth. That forms the foundation of the tooth. That's your periodontium. When the disease process ensues, then you have buildup on the tooth. The body's natural process is for your gingiva to move away from that. It will not attach to the tooth if the tooth is not cleaned, if there's a buildup of bacteria. And it causes inflammation or bleeding of the gums. And then it can lead to loss of the bone structure around the roots of your teeth. Okay, so what is gingivitis? Gingivitis is when plaque builds up. And again, remember, plaque has bacteria. The gums become inflamed or bleed, especially when you brush or floss. Okay, and then you may have some irritation of that area. It can be painful at times, and sometimes can lead to swelling of your gums. So when you visit your dentist, this is what we're looking for on the left. We use an instrument that is called a probe. Again, we measure the amount of attachment around your tooth. It does not cause bleeding when that gingival tissue is healthy. Okay, it's only when there's inflammation, such as the picture on the right. So there's an early stage of gingivitis here. And you will often know before your dentist will if gingivitis is beginning, because you will have bleeding gums when you floss. Now, if you are a smoker, you're more prone to have gingivitis. Females who are going through puberty, pregnancy, and menopause because of hormonal changes may also have episodes of gingivitis. Diabetes is often seen in patients with diabetes. Gingivitis is often seen. Or if you have an immunocompromised system or any disease that lead to that, then you will oftentimes see bleeding of the gingiva. More common than not is a family history of gum disease. You will oftentimes see that trend happening in the family. Okay, but the most common reason is poor oral hygiene. Okay, so we want to make sure that we are doing the things at home that we can to prevent the progression or the onset of the disease. Now, gingivitis becomes periodontitis, and you can see the stages here in diagram when that buildup increases. Okay, the more we allow that bacteria to increase, the more detrimental it becomes to our periodontium. So gingivitis is the very early stage. That is simply the inflammation of the gingiva, which we can work to reverse that. Now, once it spreads to your hard tissue, now we have what's called periodontitis. And when I say hard tissue, again, I mean that bone that is around your tooth, the foundation. Okay, if you allow the foundation of your tooth to be attacked, then that tooth is very vulnerable to being lost. So how do we treat this? How do we treat this? Very early, again, 6 months visit. Okay? If you have a pretty healthy gingival tissue or oral cavity, or just a mild case of gingivitis, then you would get your standard 6-month clean with hand scaling, and then prophylaxis, which is when we use the electronic device there to really polish your teeth, polish all of that pellicle or bacterial buildup away. This is what most of you are probably most common with having done when you have your 6-month cleaning. If you move into an instance where you have that tartar buildup and it starts to progress to beneath your gingival tissue, now we will move to what we call a scaling. Okay, and that is because the buildup is more tenacious. Hand scaling just simply will not remove the deposits that are on your teeth. So again, you can see the tartar buildup here on your left, and what is accomplished after a routine cleaning or scaling here on the right. Now, if your dentist recommends a deep scaling, that will let you know that you are in some stage, some level of periodontitis. That means, again, if you think about the picture of the periodontium, that means that that buildup, we look at two things. We look at supragingival, which is above the gingiva. And then from the radiograph, we can tell if that buildup is moving below your gums. And if it's below your gum, we now have to do what's called a root planing, meaning we have to remove that bacteria, that buildup beneath your gingiva that is attached to the root of the tooth, which can lead to bone loss. You are in the early stages and sometimes advanced stages, depending on the level of your bone, of periodontitis. How do you know the difference? When you go for your cleaning, if it's a routine cleaning, that's simply what it is. You have a cleaning, sometimes a hand scale, and you will get the polishing. If you're going to have a scaling and a deep root planing, then you will have to be anesthetized. You have to be numb for that procedure because, again, we are going below your gum to remove those deposits. So here we are. This is what we are looking at from our aspect as your provider. Okay. We see the buildup on your teeth. This is, again, calculus sticking to your teeth. And as you can see, it's below the, well, you can't see the gums here, but we recognize that this is below the gum. This is the bone, the foundation around the tooth. Your bone level should be around the neck of the tooth. So it should be up here. So this patient has lost bone. So the foundation is being attacked, and that is because this bacteria is present. This is after the procedure. This is after the scaling. And typically what I do after a scaling, I bring my patients back in 3 months rather than 6 months and put them on a 3-month rotation to ensure that we are doing what we need to do at home to make sure that we do not get a reversal of the process. So a healthy smile begins at home. I hope this helped you to understand gingivitis and periodontitis a little bit better so that as you have conversations with your oral health care provider, you will be attuned to what the processes are that are going on in your body or that may be going on in your body, and hopefully what we are trying to prevent from happening in your body. And we want to instill these habits, these ideas in our children, make sure that they are forming good oral hygiene habits early on in life that will last them throughout their adulthood. Thank you again to the brothers of Alpha Phi Alpha for inviting me to provide this content. And thank you for those of you who have listened. I hope that this has been very informative for you. God bless.